Folks, thanks for joining us today. My name's John Dubas with Premier Marketing. We'll be spending the next 50 to 60 minutes or so discussing why and how to sell hospital indemnity programs. Today's presentation is being recorded, and it, along with information we referenced through the course of the presentation, will be sent to all who have RSVP'd to today's webinar via email. So watch for that. Sometimes the attachments will pull it into your spam filters, so check that as well, if you would, please. A bit of housekeeping. In the software for the program, there is a section for questions. If you would, place your questions there. We do cover, we found, most of the questions through the course of the presentation, but we will make certain at the end that we address anything that we may have missed. We do so put you on mute simply because we're all kind of in atmospheres that we don't always control the sound, and so we want to make certain that there's not feedback or dogs barking or children being children, or in my case, every now and then I'll mute you because I have to cough today for some reason or another, and we don't want that to be annoying either. Watch for that if you would, please, and we'll make certain that we get your questions answered as well. We'll start with a bit of level set about Premier Marketing for those who may not be as familiar with us as some others, and a review for others. We are a national marketing organization founded in 1968, licensed in all 50 states. We're part of the Integrity Marketing platform with offices across the country. We act as an insurance wholesaler, offering insurance services through independent agents such as yourself, and we offer those services through contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full insurance portfolio that includes the Medicare programs, the Medicare Supplement and Medicare Advantage programs for the base medical, and PDP programs for standalone drug help. We also have a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. We also offer long and short-term care programs, disability income plans, and ancillary benefits that include the dental, vision, and hearing programs, cancer and critical illness programs, and the topic for today's discussion, the hospital indemnity programs. Those Medicare Advantage programs include the national carriers and many of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the standalone PDP arena, where those national carriers are there for you. You'll note on this list that it still lists the Envision RX program. That is being pulled from broker distribution everywhere, and we wanted to leave that on there, so I remembered to tell you about it. So watch for communications on that if you've been contracted with that carrier. We do also offer a full and robust Medicare Supplement portfolio with different marketing programs to help you be successful in that space as well. And in the ancillary product arena, we do offer the leaders in each of the categories that we mentioned, including the hospital indemnity programs that we'll spend the time on today. When you look at the Medicare market overall, if you speak to the folks that are just turning 65, that's all part of the silver tsunami you hear so much about. The aging of the baby boomers, 10,000 plus people a day, one every 10 seconds. I don't mean to sound disenthused with it, but it's not really a true number of the Medicare market, because we're finding many people are delaying accessing their full Medicare benefits past the age of 65, 8 to 12% thereabout. But that's more than made up by the folks that actually qualify for Medicare because of medical disability, those under the age of 65, and it's nearly 1/6 of the Medicare population. So it's a sizable slice of the prospects for the programs that you offer, including those that we visit about today. It's a diverse population that's got some health challenges. 2/3 of it have 3+ chronic conditions, and many of them have challenges with their wallet as well. The median income has gone up to a whopping $26,200 after this report, but having programs in play that can help people plan for the unplannable in many circumstances can make a huge difference as to what you have to offer and how it's received by the public that you look to help. Medicare is a series of challenges. It's also a series of choices. And when folks become eligible for Medicare, I'll put it that way because, you know, the age difference and some of the other things that the folks that come in late, they have a choice to pick up the optional Part B or not. They can decline it if they wish to. That's a first choice. And for those who don't make that decision and have Medicare Parts A and B, then they look for perhaps other programs that will cover the shortfall in those medical arenas, and then look for help with prescription drugs as well. So they may pick up a Part D program. They may pick up a Medicare supplement, a standardized, modernized Medicare supplement that pays based on what traditional Medicare pays, or they may choose a Medicare Part C plan, a Medicare Advantage plan that incorporates those coverages into a singular benefit package that's offered by private insurers. Any way we go, we've got choices here. And the plans that we offer today, the plans that we discuss, the hospital indemnity programs, can help people in each of those decision charts. So it's important for us to keep an open mind as to what we can do. What we find with the folks that are coming into Medicare for whatever reason, 65 or disabled or late to Medicare, we're seeing a pretty even choice in their initial selection period between Medicare Advantage and MedSup, and we then also see the portion that have original Medicare only. That's a bit of a misnomer because that may include people that have retiree coverage, people who are Medi-Medis, have Medicare and Medicaid. They may access benefits through the VA, or it may be that population that has chosen to do nothing at all. It's the old decision to make a decision, and they stuck with the A and B, and that's it. We do have some help for you as well to help translate the language of Medicare. Every part of our world has its own language subset within our mother tongue, and these acronyms can sometimes be confusing, so we'll send you a link to a guide to help you translate those acronyms. But let's talk about why and how to sell hospital indemnity programs. It's important to establish a baseline as to what people actually already have. And so the What's Covered app that's put out by CMS can be very helpful. It's available for all of us, and it's also available to the general public so they can better understand their Medicare coverages. Will they do that? Well, some of them will. Some of them will rely on the dependable Medicare Bible of sorts, the Medicare and You book, which they can do electronically or in hard copy. Traditionally, that's been sent to every Medicare beneficiary at the 1st of October. So CMS was kind of supporting the United States Postal Service in a degree. Some people can opt out of that mailing by receiving that information electronically. One of the things that's important to note is a base conversation that allows us to look at different products and different coverages that we can offer our prospects and clients. So the things that we have with traditional Medicare, with its annual deductible and the hospital daily co-payments, are important for us because it helps us establish a need for the base coverages if they don't already have them, options within that base coverage, the different Medicare supplement types, or the Medicare Advantage programs, and the carriers and their programs that they offer in their zip code of residence, the beneficiaries. So it gives us an idea then of some things that we can do to improve their situation financially by simply knowing what is covered by Part A and what's covered by Part B. It's then also important to have these statistics. And I'm going to go through some of these pretty quickly. I wanted you to have the slides. There's a lot of slides, but we wanted you to have these details with some of these statistics to help you find value in these programs yourself and be able to speak to folks and help them understand how a minimum monthly contribution, a premium for a carrier for a hospital indemnity program, can really help assuage these huge costs that you can incur in traditional Medicare. Because remember, that hospital deductible, the Part A deductible, is a per stay deductible. It's not an annual like Part B. So they could be, if they have certain health conditions that require frequent hospitalizations, they can run into these multiple times in a year, and that can be contributory to the bankruptcy filings that we see with many of the people that have onerous hospital or medical expenses. So the average hospital stay, that's over $11,000, and over 35 million people, Americans, were hospitalized in 2016 alone. So it's a big need in that particular circumstance. And with some older data, we can see how those numbers progress, where you have an increasing cost exposure by a hospital stay. And that is compounded by the fact that many doctors now, for people with certain conditions, will put them in the hospital, but they're not admitted to the facility, and they're there under hospital observation. And in many circumstances, Medicare only pays that in certain circumstances. So we want to make certain that we have a program that can help people in this regard and prepare for this eventuality. Some folks go in under hospital observation, just like some people go into the ER. They're treated there and sent home, not admitted. You'll see people in both those circumstances also be admitted into the hospital, and then you have additional expense that way. And it's also important to note that Hospital Part A only covers hospital care if they're admitted, and Part B needs to be in place to cover some of the medical expenses that are incurred during that hospital stay. So visit by doctors who actually look to diagnose and help them. So there are some different things that we want to make certain that we're doing to cover this eventuality as well. So when we look at these particular stays in the hospital, and let's say that they are admitted or they're not, because programs will cover both, let's look at the hospital indemnity portfolio that is offered and look at it as a point for the folks that may have just original Medicare only. So all that stuff I told you about, retiree programs, VA, Medi-Medi, those sorts of other coverages, let's look at that population of that 17% that have original Medicare only. And some of these folks may not have picked up a Medicare Supplement plan because the cost was too much for their budget. Some of them may have not chosen a Medicare Advantage plan because they didn't want network restrictions, or the benefits weren't enough to entice them into the program, or they just don't know about it. So they have an exposure to those large amounts with traditional original Medicare. And a hospital indemnity program may be of help to them. If we look at the Medicare Supplement option to cover that, depending upon the Medicare Supplement type they select and that you walk them through, or however they come up with the program, you'll notice that in certain plan types, there are exposures that can be very helpful in this regard as well, even if they are still able to pick up a C and an F program because they had Medicare before January 1st of 2019. So we have some different things in play that can still help with a Medicare Supplement individual. And it's also important to note that even if they pick a plan with very complete coverage, let's say the Plan G that has just the Part B deductible that's outstanding, it covers the approved medical expenses. But as we go through some details later, we'll see that there are many other expenses that are part of a hospital stay that aren't medical in nature and still need some assistance in helping them with that coverage. So if we look at MedSups, we can go into one of the tools we have available for you as a contracted agent with Premier that gives you an opportunity to examine those different Medicare Supplement types. It gives you the opportunity to set up a discussion about their coverages. Obviously, with Medicare Supplements and hospital indemnity or dental programs, you don't need a scope of appointment, but many times that conversation goes to, well, what else you got? I'd like that Cadillac, but I can only afford a Chevrolet Vega or something of that nature. So it leads into a conversation with other options, and completing a scope, then you can carry on with, the full gambit of their choices. It does, however, with Medicare Supplements, allow you to use that same tool, not just to offer them a complimentary Medicare Supplement review. And by the way, make certain that you have the med subs in your portfolio you need to sell in your market. But it also gives you then the opportunity to quote those hospital indemnity programs for the folks that have a need for them or express a need, or you make them aware of some of the other expenses they may be encountering. When we go into the Medicare Advantage arena, it gives us an opportunity to fully explain those coverages. But what we're seeing, particularly in 2021, with the introduction of ESRD being part of the MA benefits, whereas before that was a knockout question, one of the few knockout questions in a Medicare Advantage plan, we're seeing that the max out of pocket on those programs are increasing. And you'll see a two-tier max out of pocket if it's a PPO program where you have a deductible to satisfy in network and another one to satisfy outside of network. And even though traditional Medicare doesn't have a maximum out of pocket at all, the max out of pocket to this point in time for in-network charges of $6,700 is very difficult for most and many, I should say, Medicare beneficiaries to come up with after a hospital stay. So we want to make certain that we do some things to help them cover that little piece of the good and the bad and the ugly of a Medicare Advantage plan. I used to like to describe it that way simply because it did offer some pretty cool benefits, many times at a zero premium, but it had the hospital copays, it had the co-insurance for therapeutic radiology treatment for cancer, and you had some different things with DME and coming out of the hospital for a SNF benefit as well. The hospital indemnity programs in many circumstances have riders to address all of those issues, and you can quote as well. Let's say you also run into an individual who has an MA plan, is happy with it, basically made an appointment with you to reassure them that they made a great decision, or they're fishing with you to make certain that they know about any changes in that program moving forward. This particular piece allows you to go into that software package, the Cst Software Package, and you'll see up here, fill the gap. You select the plan that they are on, you click to fill the gap, and it will actually walk you through the different carrier choices that you have and the plan choices to seal that crack in the coverage. This is showing you a recording that we've made of that cross-selling that you can access on YouTube to help understand how to work that part of the system. And then, of course, we have the Medicare Center program, which gives you the opportunity to do those plan comparisons for Medicare Advantage programs and PDP programs, store your scope of appointments in there like you can with the CSG tool, and then do year-over-year reviews based out of that program. So reacquainting ourselves with the different hospital indemnity programs that we have, it's probably a good point to start with the base remedial, what is a hospital indemnity program? And these are flexible supplemental coverages that are fee-for-service that help with whatever the base coverage happens to be. If it's just the Part A, they decline the Part B coverage if they have A and B, if they've got a Med Sup or they've done a Medicare Advantage program, or if they're under 65 and have a major medical program not on Medicare. Many of these programs will have an age range that starts at 0, goes to 90. So you have flexibility there, whatever the age of your prospect or client. These are programs where the individual selects a daily rate. That's why it's important to know their base coverages to fill in those holes. And in certain circumstances, it allows us then to add other riders that can be very, very helpful for them. It's a particular perceived need in the Medicare Advantage arena because of those daily hospital co-payments that they have to make, or the per stay co-payment that they have to make. But it extends beyond that in many circumstances to not just the hospitalization stay. It also helps with cost of services that are delivered before a hospital stay, some of the tests and things that come into play before hospitalization. It helps with after they get out of the hospital, and it can be very helpful for individuals on an outpatient hospitalization as well. We've seen a great increase in some of the day surgeries and some of the other things that are done on an outpatient basis, and the programs are effective in helping with those costs as well. So if we go in before hospitalization, this may be a visit to urgent care, it may be the transportation by the ambulance, it might be the ER charges, and you know how they can be. They can help with a lump sum cash payment for each of those. During hospitalization, obviously that's where we come into the daily cash benefit and can help for other plays that come, or other factors that come into play for some of the family and some of the non-medical that happens when the significant other or family members in the hospital and the family congregates around that individual. Because when you look at that, even once they come out of the hospital and they go into a SNF unit, you will see complete coverages up front with some carriers. You may see a program where they have to come out of pocket for a period of it. But let's face it, the SNF benefit period is 100 days. Some people think it's an automatic segue into long-term care. That's another webinar altogether. But in 2017, the average daily cost for a shared room in a SNF unit was $227 a day. And that can add up really quickly when you got multiple days. Most Medicare or most hospital indemnity programs offer additional riders that help pay for those services as well. So keep in mind, it's also very helpful to act as a bit of a cushion for the transition for an individual who may need further therapy, you need dollars for that, or someone who goes into long-term care and the time period between that SNF unit and when they can actually be admitted into a long-term care facility. Sometimes folks don't realize that, particularly like if you're in a VA situation or Medi-Medis, or sometimes even just Medicare with a good old-fashioned Med Sup, there might be a wait for beds in that person's particular area in a long-term care facility. So we want to make certain that we cover that as well. So you've got some different things that can come into play that you need to address that go beyond the medical expenses that we've talked about during these 4 periods, and of course, non-medical expenses that a person incurs because of a hospitalization stay. These plans can vary in cost. A lot of it, of course, is based on the benefits that are selected as part of the program. They can be very inexpensive, and many carriers will accept patients with pre-existing conditions. Most of them are not fully underwritten. Some of them will do just a script check. Some of them will look into medical records depending upon how it works. But it's important to note that some of these programs may have waiting periods, some do not, and we want to make certain that we fully know the choices that we have and the options that we are laying out for that individual. Keep in mind that these are fee-for-service programs that pay in addition to any other type of coverage that they have. It's something that needs to be filed on, and then the check from the program goes directly to the beneficiary. And they can spend it however they want. It may be to cover those other medical expenses that were left for them as their financial responsibility. It may be some of those other expenses that we're to talk about. So let's look at some of the reasons why the people we serve would go into a hospital. This is a little ad off of Facebook that speaks to the fact that every 40 seconds, a person suffers a heart attack or a stroke. And that's a pretty scary number. So over 500,000 people in our country a year that have a first stroke, and you layer on to that over 200,000 people a year that have a second or third or fourth stroke. Folks who have a stroke are more susceptible to have another one down the way. What's it cost for a person going in to the hospital for a stroke? Well, a lot of that depends upon the severity of the stroke, how long they're in the hospital, but a typical 3-day stay for that is $30,000. And you can see the chart here where it gives you information as to how long is that person going to be in the hospital and how long is it going to be for them to really feel that financial pinch because of that hospital stay. It can be kind of a bit of a unexpected burden as well, because some of the people with more severe strokes might be in an ICU, transition to a regular bed in the hospital, and then when the staff there feels they can be dismissed, there's a SNF stay, and in many circumstances, at-home therapy thereafter, and for some folks, it's an entry into a long-term care facility. When you look at some of the other things that puts a person in a hospital, look at cancer, and you look at the cost of cancer treatment itself, well, 27% of those overall costs are inpatient stays, and some of the other things that hospital indemnity programs can be addressed. So the outpatient or office-based visits thereafter, the ER visit, and home health for folks thereafter as well. A lot of that is caused by a removal of a tumor or whatever else it happens to be that is part of that treatment for the illness. I don't talk about it a lot, but I have multiple myeloma. And 3 years ago, this coming Thanksgiving, I went in for a stem cell transplant, was in the hospital for nearly a month for that. Had a really cool room with a view. The rest of it wasn't too terribly pleasant. But you can see then in circumstances that if you go in for a surgery, you may be in there, well, depending upon where the tumors are and how big they are and what they find out once they're inside of you. You might have just a couple, 2-3 days. You might have much longer than that. Or depending upon the severity, well, it might be, like me, nearly a month or even longer. You also have certain types of therapy that can only be delivered in a hospital situation in certain circumstances, and that includes that radiation therapy. And that, of course, can contribute to a stay as well. So if you look at the overall cost for those stays, this is a survey that was done by the that was published by the American Medical Association, and it gives you some of those challenges that you have. And this one speaks to patients with prostate cancer. And there's a normal course of treatment that is a standard 28 fraction treatment, and those costs run from over $18,000 to nearly $400,000. Mean stay over nearly $112,000, and that's 10.1 times the amount paid by Medicare. So you can really rack up some huge bills in this particular circumstance. And then you have to deal with some of the non-medical expenses as well that you think of. Treatment, well, gee, that's only really about 43% are affected by the cost of the treatment, which is still a pretty good chunk of folks. But you also then have to deal with some of the family members that might be traveling in to stay, or a person may be traveling to receive that payment. There's a lot of popularity with certain cancer treatment centers, Mayo Clinic, MD Anderson, Sloan Kettering come to mind right away. And folks travel to have that treatment done in those facilities. If the person is still working, of course, they're not working when they're being treated. I tried that when I was in the hospital. I was largely ineffective at that, but we gave it a good whirl. So for many folks, they lose their wages. And then when they come out, there's the home care and caregiving that comes with it. Some of that is hired out, some of it's family, and sometimes that requires respite care for the caregiver. And there are other expenses that come into play too. But if you look at it, in 2015, 5 years ago, cancer cost Americans aged 16 to 84 $94 billion in lost wages. So that's one of those very pertinent expenses that many people don't think of when it comes to treating cancer. I like that slide, I think, so much. This is some of the hardships that are actually experienced because of cancer costs. So you got the paying of the bills, of course. You got the struggle to buy food. Sometimes it requires a certain diet. Sometimes folks, if they can't afford it, they'll avoid tests or put them off. Sometimes they can't afford some of the medications. And so they will deal with that by lowering the dose or skipping some of the treatments. I am currently on a therapy with 2 chemotherapy drugs that are for a total of 24 pills. If you had to buy them without insurance or an assistance program, it'd be $37,000. Well, I don't know of a lot of people that can do that month after month. And so they'll look for help outside of it. And sometimes in order to get there, they'll look to modify their own treatment, not adhere to the prescribed therapies that are laid in place for them. And it drives some people into bankruptcy. This gives you a little bit different look at some of the other things that come into play. Obviously, there are some challenges that need mental health services. There are legal services that come into play, obviously, as well. Special food, we've talked about some of these other pieces, and that can be a huge expense that most people don't think of. One of the other things that comes into play is, hey, that little experience that we're all going through right now with COVID-19 and the pandemic. Based on certain ages, well, you can see this, where a lot of the people that we deal with, that's a hospital stay. These hospital stays affect other treatments as well. Cancer people, I speak to that like I probably shouldn't, but it can delay treatment for those folks. And we've all seen some of the challenges that hospitals have had with the delay of some of the elective surgeries and how it's adversely affected their budgets. It's helped some of the insurance companies out in the quarter, but hey, that'll catch up to them next quarter too when they open things up, hopefully, and a lot of that backlog of needed services come into play. One of the other things that I really wanted to bring up as well that causes people to go in the hospital, and sometimes we don't think about it, is the old commercial of, hey, I've fallen and I can't get up. What happens with a lot of the senior population when that happens? They break a hip, or they may have a traumatic brain injury. And that happens much more than you might think. So we see that 1 in 4 older adults fall each year. And with the people aging in as they are now, that's going to be a growing number for the foreseeable future. And we have to take this into account as well. So when we look at how we can internalize the value of a hospital indemnity program, kind of an afterthought for some people, it's the fact that there are multiple reasons why a person will go into the hospital. We didn't even talk about accidents. And it gives us an idea that we feel better about offering this program, remembering to offer this program, and by having some of the details that we have in real causes that drive people into a hospital, and with some of these statistics, you can really show the value of these products to the folks that you visit with. We talked about, referenced a little bit, the hip fracture, the brain injuries. Sometimes it can even cause death. So you have different things that come into play. And this was actually from a communication today from the Centers for Disease Control Fall Prevention Team. They've got a ton of really good material that deal with falls that many of us, hey, we don't really even think of that. This really can help bring that into play as well. And sometimes folks will say, well, are there other things that can help us outside of the hospital as well? That's when we have our portfolio of critical illness and cancer programs that we can go to, that we can either layer on or do in lieu of a hospital indemnity program. So let's throw through some of the carriers that we offer here at Premier. Aetna Senior Supplemental's got some really cool programs, some really cool sales presentations that you can share with the public, so it can actually be your sales pitch. Hey, let me ask you to watch this short video that can explain the need for these programs that we've been discussing. They also then, as we'll note with most of these carriers that come, have really simplified the process of adding that benefit to their overall benefit package, our beneficiaries and clients. It can be a nice way of going back to people after AEP, but it's also a thing that you need to mention so the guy or gal that comes in after you that does mention it doesn't swipe your opportunity for future business, or perhaps even knock you out of the box with the coverage that you have with the folks that you visit with. So the Aetna Quote and Enroll program is a really nice piece that you can use, particularly if you're offering a Med Sup, in the same process. So you can just ask a couple of different questions that may be required for the program, and it's a seamless way to sell 2 policies in a house for an individual. Great way of doing it. You have short videos that you can use to educate yourself on Aetna's color of lipstick that they have on these programs. Great way for you to go in and learn more about it. And they have a lot of marketing collateral to help you as well. So a really good option for you with Aetna. GTL, Guaranteed Trust Life, is perceived by many as one of the leaders in this field. They're one of the largest carriers with app count in this area, and they have a ton of really cool tools that can help you as well, both with your understanding of these programs. And we've done webinars with GTL and Aetna and every carrier that we speak of today, save one, that speak to their programs. So you can actually do your homework at your convenience and offer that presentation tool that GTL has that will give you the opportunity, much as those videos I showed you with Aetna, that does the presentation for you. And GTL has a ton of nice add-on programs that you can put into this, the different writers, as all the programs do. But this really helps you then establish the need, explain the program, and walks you into an enrollment process. It also has some tips for you as to questions that you can ask. Let's see here. So like this, Medicare Advantage plan should provide the coverage you need. However, copays can add up quickly if you're hospitalized for more than a day. And while I double check your Medicare Advantage application for accuracy, let's watch this short video how we can address and reduce some of those potential copays. So this is a piece approved for the public, a little over 3 minutes long, and a great way for your computer to be selling for you while you are completing an application as well. Heartland is another great option with their Secure Advantage program. It is available in 35 states at present, so you have a little bit different scope with this one than you do with GTL, who may have more of a national footprint. But I mean, that doesn't matter to you if it's in your state, obviously. And so they have some different things that come into play, including a guarantee issue period, which GTL does as well, a household discount, some different things that can come into play with a dual application. So you can set up a couple with their own programs, but on one app, a great way to cut down on some of your paperwork or speed up an e-app process, because, hey, they got a great quoting tool in e-app as well, and some really great agent support on the back end for you too. Medical has come out with some really cool improvements on their HIP program. They really address that observation period, and they have some great base programs at good rates as well. They also give you some different tools that can help you sell. There's a one-page piece that is a diagnostic piece, and then, of course, some different pieces that help explain the program to you. Medical is really good about doing webinars on their programs as well, and they will do programs just on their HIP program, but they'll also do a number of them on the cross-selling techniques that come into play to help you add this program to some of the others that are available as part of their portfolio. They don't offer MA or PDP programs, so the base medical is a Med Sup. They speak to the value of a HIP program with those programs as well. We already talked about all those expenses that can come into play outside of just the base medical. It's crazy. One of the articles I ran across in researching this is the cost of parking at hospitals. 23% of the treatment centers for these programs offer complimentary parking. Others, that can become a major expense. And that link to that article will come to you as part of the follow-up as well. So you got some great tools that come to you from medical. a great explanation of the program, and different programs that can help you with their e-enroll program as well. That gives you an opportunity, not just what we talked about with a couple of the others, where you're completing an e-app for an individual, but you're kind of, to quote American Pickers, bundling the different types of benefits. When you look at SureBridge's offering in this area, their hospital-wise program, we've done webinars with SureBridge that help explain their portfolio and some of their systems and the contracting and everything that come into play, and a discussion of their hospital-wise programs. So you can access that as well. A link to those will come as part of the follow-up that's coming to you afterwards. But they've got some really cool ways of simplifying the process for you. 90% of the submissions are issued in real time. So you have a almost immediate gratification for the folks that you visit with. They got some really good agent support and a ton of signature options that can come into play. So face-to-face, email, voice signature, text, and even screen sharing. They've got a full bundle of the electronic means of reaching out to an individual. I mean, that's important with these programs. If the situation carries on as it is, where in certain areas, the areas are shut down, others are not, it also really helps us with that population that is tech savvy, and that's the way they want to be sold. In the near future, the near normal, well, hey, not as many people, in my opinion, are going to want a face-to-face. Ton will, but we have to have the tools in play to help address that population that doesn't want to or can't see us at that particular point in time. So you've got some nice pieces that come into play here that can really help you with SureBridge opportunities as well. When you look at Washington National, they speak to the way that the need is there because of the monies that come out from a hospital stay, and they have a virtual toolkit that can help you do things electronically. And then, of course, like all the carriers, you still have the supplies available to you in good old paper, and there's some folks out there that want to have something tangible for an intangible product, so that's an option for you across the board. They also have some really cool pieces, Washington National does, with helping with Zoom backgrounds, if you're doing a Zoom presentation, be it with an individual, or if you set these up for a seminar type of selling. And that's important for us to keep in mind that in our marketing plans, the present atmosphere isn't as big a factor as you might let it be in your own mind. Because if you set something up as a live presentation, not virtually, circumstances don't change, or if there's a relapse in the second wave of some things coming through, well, it's pretty simple to quote friends and pivot and do it electronically. And when you introduce this technology to some of the centers of influence that you're using to do those presentations or on your own, it helps you and your partners, your centers of influence in that community across the board. So they've also come out with a number of programs that can help you with that virtual toolkit, steps in to help it make it easier for you and make certain that you're addressing things with flexibility. Because if you think about this, regardless of the carrier that you use in the hospital indemnity area, or whatever option a person has selected for their base medical coverage, it's important that we have flexibility of programs to work with these individuals, and we incorporate them into an overall comprehensive plan that we have in play to satisfy our own goals for the remainder of the year for AEP and moving forward. So there are some additional trainings that we would recommend that you take advantage of. If you're able to catch every fine detail with every one of these carriers that we discussed, well, gee, then I'm psychic in addition to psycho, and you don't have to do these carrier trainings. But boy, I'd surely recommend that as you pick a partner, you run with the training and the support that they have available for you as well. It's a great way to learn of all the marketing opportunities they have, the marketing collateral and support that come into play. And while certifications aren't necessary with hospital indemnity programs, some of the base programs you have to fully cover an individual, those do require certifications as well. And even if you don't offer a HIP program moving forward, get your other certifications done. These are programs that also can be a starting point of a lead generated in a retail setting. And in order to participate in those programs, most of the carriers, and Walmart certainly, requires optional training to participate in those programs. And it's a great way to help understand some of the different nuances of making that investment of your time and money successful for you as well. So we lay out some additional ways of making that campaign successful for you by grassroots marketing, bringing in the area within the immediate propinquity of that location for you to ingratiate yourself in that center of influence for the entire year. It's important to know about the low-income subsidy and Medicare savings programs that are available, because that might affect the perceived need for some of these programs that we discussed today. Being comfortable with those enrollment systems, those quoting systems that I referenced earlier, is really tantamount to your success, because, hey, if you stumble in them, you're going to prolong your appointment time. You're going to burn up some of your most valuable resource, which is your time. Thank you for investing with us today. And being able to do that fill-in-the-gap presentation can be really, really helpful for you. So make certain that that comes into play, and be familiar with that Medicare.gov guide, that Medicare and You program, or some of the other periodicals that Medicare offers for the different plan types. Be familiar with them. I'm not saying memorize them. Page 49, however, is the one in the Medicare and You guideline that's what isn't covered. So knowing those can make a difference in how you're perceived and how you carry on. Keep in mind those 2021 carrier benefits, for the most part, are all out there. One of the few ones that just is rolling out is a regional here in Texas, Baylor, Scott and White. So we have all those details here for you in and on our website behind the portal, and that can be really helpful for you. And then, of course, the certifications, where I blocked this out on the 2020, simply because if you're picking up a new carrier or hadn't certified with anybody before, completing the 21s also satisfy you for the 2020s. And access some of the trainings that are available through CMS. Their Medicare Learning Network is really, really helpful. It's where I obtain a lot of the presentations that we can use in our group setting, be they live or virtual. I would recommend that. And remember, be flexible. Be ready to pivot, because you might have to do things a way that you may not be as accustomed to or maybe as comfortable with electronically. And that's where our homework being done now can be helpful. Getting in front of folks for these programs, it carries on with a lot of the activities that we're already doing. You can cold call for a hospital indemnity program. You can cold call for a dental program. You can cold call for final expense or med subs. You can't for MA or PDP, obviously. But you can use community-based programs as well. By the way, we can get you a list for the cold calls if necessary, or if desired, I should say. But maximizing the centers of influence in your community can be really helpful to get into a household to offer any of the programs that are part of your portfolio. The retail marketing usually center on the MA and PDP programs. In certain areas, a taste of the med subs as well. Keep in mind retail, so they can drive to that facility for their drugs, so you got to keep that in mind. Utilizing your services with the faith-based community can be really helpful for you and that location as well, to think of some of the challenges that they have with serving their congregations and their populations as well. Same thing carries over to providers. That can be doctors, that can be specialists, that can be dentists, anybody who delivers the care for the program that you're offering. Home health carriers, DME carriers, things of that nature. So that's important for you to keep in mind as well. There are different carrier programs that support you. A lot of that is a quid pro quo for your relationship with that insurance company. So they may offer you some lead support. It'd be a great way to do that base program, and then you're cross-selling with whatever the needs may be. Hospital indemnity, critical illness, those sorts of things, the dental programs, final expense, life insurance, long-term care, everything else that's part of your portfolio that you're looking to make certain to utilize with folks that need those coverages. You have social media programs that can help you. Of course, it's obviously very important for you to use some of the best lead sources, which is a referral, and then, of course, direct mail. Direct mail is not dead. We'll talk about that in a second. We have Facebook lead programs that can help you, programs that generate some leads very quickly at a price that's very reasonable and allows you to purchase them in quantities that your budget allows as well. Can't forget those referrals and engaging not just the people that we are selling now to get you in the new households, but going back to our current book of business, doing a referral, a review, and a referral request as well. Those direct mail supports are supports based on production, but it can really drive down the cost of your direct mail, allows you to do it consistently. Because with any of these lead programs or marketing support programs, consistency is the key. Think about if you exercise. You do it once, you feel the pain. You do it regularly, you see the results. Carries over into a whole bunch of things that we do. We work our mail support program through preferred vendors because we vet the letters that go out to make certain that you stay in compliance. We don't want you in a compliance hell situation, hot water or whatever. And it's important to put those things in play now if you're looking for lead flow, particularly in AEP. Kicking out your mail support now and then perhaps again during AEP can really, really help you with a good pile of leads waiting for you. And for those of you that don't want to finance and gamble a little bit on the return, we do also have programs that are available based on direct mail on non-distributed direct mail support. These can be T65s or Med Sups, and they have introduced a program too that is a discounted program for leads that hadn't been distributed for 60 days. So kind of an age lead situation as well. So you've got some options there within the direct mail arena. It also gives you the opportunity to choose different mail programs during different parts of the year and consciously look to cross-sell. Because the more policies you have in a household, the higher your persistency is across the board. Studies have shown they don't even have to be with the same carrier, they just have to be with the same agent, and that's you. Some of the things we can do to help, in addition to what we discussed, for those of you that are looking to contract with multiple carriers or just want a place to put all your information and your questions that are commonly asked on contracts, Insurance Bay program allows you to create an agent profile, have your data in there, and for a great many of these companies, you can contract electronically directly through this and select from multiple carriers, and it'll autofill for you. Great way to address carpet tunnel and making certain that our handwriting isn't a concern or we don't miss an initial here, signature there type of situation. We also offer discounted errors and admissions coverage to a qualified agent. What makes you a qualified agent? You got to contract with us. But this is a program not like being added to a blanket E&O policy for a particular product. This is a program you own and at a reasonable rate and allows you to cover yourself financially regardless of who you're contracting through. So a great way to give flexibility to an independent agent because let's face it, I don't know of any marketing organization that has absolutely every program everywhere. And you need to make certain that you're protected across the board. And obviously, E&O is required by most contracts with different carriers. We also offer online continuing education and a discounted arrangement through our relationship with WebCE to keep your license in play. And you can actually add to your own benefit package by picking up DI coverage on a modified guarantee issue basis at a discounted rate where you share in the commissions. So a great way to add to your own benefit structure as an independent agent. Much as where today's presentation is being recorded, we have a vast library of past presentations that deal with marketing concepts, product type, much as today, specific carrier information, and it's all available to you on our website or our YouTube channel 24/7. Don't forget those tools that are available to make you more efficient and more effective by doing some things electronically. Many agents had adopted the electronic application, which solved the whole penmanship issue and time and remoteness, doing some things virtually ahead of time. But those tools are available for you to use at no cost to you as a contracted agent. We also make certain that you realize there's additional compensation for certain programs. We have it in a contained spot on our website, so you can go in and look at not just the trips. Because some folks, hey, if I want to take a vacation, I want to go to where I want to go, and I'll go by myself, and I don't want to sit through a bunch of meetings, yada, yada. But there are also a number of different incentive programs that are additional incentive for you to offer a particular product through a particular carrier. And those programs do help you qualify for Premier's producer convention and incentive programs as well. All said and done, we're getting close to the top of the hour. It's a question of incorporating in the different options you have and perhaps understanding our plea to work with you. We want your business. And we do so, hopefully, through a very robust portfolio, a ton of great back office support out of Norfolk, a bunch of really good marketing ideas and support that can help you be successful in the insurance world. And it gives you then the opportunity to reap the benefits of what you're doing with all the hard work and all the hard work and sacrifice that you go through in order to be successful in your chosen area. Because let's face it, we have a lot of rejection, and sometimes having that support can make all the difference in the world. You can reach any of us here at Premier on our website at premiersmi.com or through our toll-free number, 1-800-365-8208. If you're working with a different or a specific Premier success manager, agent success manager, your marketer, you can reach them through that number, obviously. If you're not, dial in and we can have some really talented people help you. Let's look and see if there are questions that come into play. Let's see here. Is this available in California? Some of the carriers are and some of the carriers aren't. So what we'll do, and thank you for that question, Nina, we'll make certain that we have links that give you product availability maps with each of the carriers that we have spoken of today. If the person dies while in the hospital, is the benefit still available for the time period that they are alive in the hospital? Yeah, it does. Can a person who already has cancer buy a hospital indemnity program? Pause for dramatic silence there. Unfortunately, that may be a circumstance where you're looking to insure a house that's already on fire. That would be a no. How can we get comp info? That is a discussion with your marketer, person who asked that's left the presentation. This is a situation where it will depend upon, are you at a certain level of production, because they can be graded out for this. Can you qualify for different levels? Are you looking to recruit? So there's some variables that can come into play there as well. So we will do some different things to make certain that we get you taken care of in that regard, and watch what we can do for the follow-up information that will come, and we look forward to visiting with you in the very near future. So all that said and done, we want to thank you for the time that you have invested with us here today. Watch for that follow-up, and we look forward to visiting with you in the very near future. Thank you. We appreciate the partnership, the potential partnership, and the business that you have delivered to us already as well. All that said and done, until the next time we visit, well, I wish you good selling. Thanks so much, and we'll talk to you very soon.